Ministry of Health of Ukraine. Krok 2. Medicine. Year 2021. Number 031. A 55-year-old woman complains of pain and popping sounds in her left knee joint, which occur when she climbs the stairs. Occasionally during movements her joint becomes stuck. 5 years ago she suffered a trauma of her left knee. Complete blood count and biochemical blood analysis show normal results. X-ray shows marked osteosclerosis and osteophytes. The joint space is narrowed. Make the provisional diagnosis. A. Reactive arthritis. B. Rheumatoid arthritis. C. Gouty arthritis. D. Osteoarthritis. E. Psoriatic arthritis. Osteoarthritis is so-called a degenerative joint disease or wear and tear arthritis, the most common form of arthritis. It occurs most frequently in the hands, hips, and knees. In the patient, the cartilage within a joint begins to break down and the underlying bone begins to change. It usually develops slowly and gets worse over time. The symptoms of osteoarthritis include pain, stiffness, and swelling. In some cases, it also causes reduced function and disability. Therefore, some people are no longer able to do daily tasks or work. Osteosclerosis refers to thickening of trabecular, spongy, cancellous bone. Hyperostosis describes widening of cortical, compact bone. Osteophytes are bony lumps, bone spurs, that grow on the bones of the spine or around the joints. They often form next to joints affected by osteoarthritis. Diseases that can cause arthritis. Rheumatism, a condition causing chronic, often intermittent, pain affecting the joints or connective tissue. Rheumatoid arthritis is an autoimmune, chronic, inflammatory disorder that can affect the joints, causing a painful swelling, resulting in bone erosion and joint deformity, as well as the skin, eyes, lungs, heart, and blood vessels. Psoriasis, a chronic autoimmune skin disease that speeds up the growth cycle of skin cells. Psoriatic arthritis eventually occurs in 10 to 20% of people with psoriasis. Gout, an inflammatory, very painful arthritis. It usually affects one joint at a time, often the big toe joint. There are times when symptoms get worse, flares, and times when there are no symptoms, remission. Reactive arthritis, an arthritis that occurs in reaction to something, for example, a bacterial infection in the digestive or urinary tract or the genitals. But arthritis symptoms typically do not set in until after the patient has recovered from the infection. Inflammation of the joints, eyes, and urinary tract are hallmarks. Blood tests, sedimentation rate, C-reactive protein, CRP, the values are higher in inflammatory diseases. Rheumatoid factor, RF, anti-cyclic citrullinated peptides, anti-CCP, autoantibodies are proteins which immune system produces that attack healthy tissues. Human leukocyte antigen B27, HLA-B27, a protein found on the surface of white blood cells. It is associated with ankylosing spondylitis and other associated inflammatory diseases, such as psoriatic arthritis, inflammatory bowel disease, and reactive arthritis. Uric acid, the value is high in gout. The answer is D. Osteoarthritis.